Hello and welcome to the Pediatric Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. The newest fad for youth is dangerous and addictive. While the prevalence of smoking tobacco by teens has decreased significantly over the years, nicotine delivery has resurfaced in a new format. Whether referred to as vaping or juuling, the use of electronic cigarettes has implications for the pediatric nurse as well as for the health of the youth. Pediatric Nursing, a peer-reviewed clinical journal for pediatric nurses, published a feature article on vaping in its January-February 2019 issue. The article, entitled "Vaping, It's All a Smokescreen," was authored by Dr. Janice Selekman, Professor Emeritus from the University of Delaware in Wilmington, Delaware. In this episode, Pediatric Nursing Journal editorial board member Dr. Bernice Mowery, a nursing research scientist from the Inova Health System in Northern Virginia, interviews Dr. Selekman about the use of e-cigarettes and vaping in teens, the serious health risks associated with vaping, and the important role pediatric nurses can play in preventing or decreasing this practice. We are pleased to present Dr. Mowery's interview with Dr. Selekman.
Hello, I'm Dr. Bernice Mowery, an editorial board member for the Pediatric Nursing Journal. It is my pleasure to welcome Dr. Janice Selekman, Professor Emeritus from the University of Delaware and author of the article, "Vaping, It's All a Smokescreen." Dr. Selekman has been a pediatric nurse her entire career and is a national expert in school health. Dr. Selekman, why is vaping such a hot topic?
There's actually 4 reasons. 1, it's the most current fad of children and teens, and we all want to be updated on what the current fads are. Number 2 is most adults don't understand it, which is always enticing to youth. Number 3, it has a very high risk for addiction. And number 4, it is potentially deadly.
So please explain, what exactly is vaping?
Well, there's actually 2 components to this question. Number 1 is the implement used to vape, and then how it is used. The implement goes by many names: electronic cigarettes, e-cigarettes, Juuls, Juuls, which is actually a brand name of an e-cigarette, but very popular among youth, vape pens, and hookah pens. They are officially called electronic nicotine delivery systems, and they come in all different shapes and sizes. There's 4 components to these implements. They are battery-operated devices. They have a mouthpiece through which you inhale, a reservoir or a pod or a cartridge, it goes by multiple names, that holds the liquid with the nicotine, the atomizer or heating element, and the battery, which is often able to be recharged. The answer to how it is used is to inhale, and that's referred to as a hit or a puff from that mouthpiece. And when one exhales, an aerosol or vapor is produced, and this is why it is referred to as vaping. It can also be referred to as juuling.
Why is vaping or juuling so appealing to young people?
The primary appeal is the flavoring added to the solution in that pod or cartridge. There's over 7,000 different flavors, including caramel candy, tutti frutti, mint, mango, gummy bears, and lots more. Another reason youth like the devices is that they can hide them from adults. Many of them look like USB flash drives or even mascara devices. And there are many sites, including in clothing and hollowed out highlighter pens and even in book bags. When the battery is being recharged on a laptop computer, it's very difficult to tell that it is not a legitimate flash drive. Another appeal is that teens can more easily get away with using it in school or home without being detected, since the odor is not as strong as when one smokes a cigarette. You can just take 1 or 2 puffs of the nicotine rather than finish what would have been a whole cigarette.
So we see the appeal. Why is vaping such a big deal then?
Well, number one, it's addictive. There are high amounts of nicotine in these pods, and vaping is now causing a whole new generation to become addicted. Nicotine is one of the most highly addictive chemicals available. Second, we are just beginning to know about the long-term consequences of it. We will address these in a minute, but it is worth noting that nicotine can interfere with brain development, which continues until one is about 25 years of age. It's also toxic to developing fetuses and thus poses a health danger to pregnant women. Third, the increasing use of electronic cigarettes has been declared a public health crisis, with almost 50% of high school students having tried using the devices. Promoting the negative consequences of smoking through public media and policy changes made a huge difference in decreasing the number of youth who smoked. In 2015, we marked the year with the fewest number of teens who were smoking cigarettes in the past 40 years. In 2018, only 10.8% of teens had smoked tobacco in the past month, but almost half of all teens, had tried vaping, and many had become addicted. As a comparison, only about 15% of American adults smoke cigarettes.
Vaping devices, though, were developed and promoted as a safer alternative to smoking cigarettes. How do you respond to that comment?
Well, number one, they are not safe. They result in a nicotine addiction, and we are hearing daily reports of serious health hazards resulting from vaping. Number two, they were unregulated until 2016. So the research is new, and so is the reporting of all the negative consequences. The numbers we hear today are really just the tip of the iceberg.
But is vaping safer than regular tobacco cigarettes?
Well, there's a lot of false advertising about the safety of vaping devices. It is true that there is no tar in the vaping devices, and tar in cigarettes is what sticks to lung tissue and attracts cancer-causing chemicals to stick to it. There's also no need for matches, but there are many dangers. Number one, the flavorings are inhaled. The advertising promotes that the flavorings are safe, but they were only approved for ingestion or eating and not for inhaling. They are not safe in the lungs. Number two, the metal coil that is heated by the battery causes metals to be inhaled, such as lead, chromium, and nickel. These chemicals have never been approved for inhalation. Number three is the amount of nicotine inhaled is not controlled. It really depends on how deeply you breathe it in. This results in nicotine overdoses, especially when young children get access to the devices. Nicotine overdose has been associated with seizures. It should be noted that the pods contain high levels of nicotine. It's also been reported that the nicotine content in e-cigarettes has more than doubled in the past 5 years. Number four is that kids are adding THC. This is the active ingredient in marijuana into the pods, and it's very difficult to detect that. Number five, secondhand smoke is now acknowledged with these devices and can be measured in those in the environment. What has emerged is that whereas smoking cigarettes is strongly correlated with the development of lung cancer, heart disease, and stroke after many years of smoking, vaping is causing increasing numbers of lung failure within a short period of time of using the product. This is especially true when some flavorings are heated. One condition that had been known about results in something called popcorn lung, or bronchiolitis obliterans. This causes inflammatory obstruction and permanent scarring of the airway. More commonly, and in the most recent research, the lung involvement looks like a serious case of lipoid pneumonia without any infectious agent. The lung damage may be related to inhaling the oils in the pods, and once inhaled, these oils congeal in the lungs. These oils were not approved for inhalation. In addition, certain flavorings also appear to damage human blood vessels, increasing the risk for heart attack and stroke. As of September 9th, 2019, there have been over 450 cases of this mysterious lung disease in 33 states, and many have resulted in respiratory failure and the need to be placed on ventilators. All of these patients who are involved with this lung failure or lung disease had vaped, and 5 have now died. These are not your typical elderly or those with previous lung problems. These are usually healthy teens and young adults who had only been vaping during the past 1 to 2 years. In terms of safety, we should also note that there is the danger that the lithium battery can explode, causing serious burn injury. We've heard of that with other devices. Finally, it is very difficult to withdraw from nicotine addiction when using the Juul. The success rate of withdrawal is somewhere between 9 and 18%. Young people who use e-cigarettes, electronic cigarettes, may also be more likely to move from the electronic cigarette to regular cigarettes.
Thank you so much for that explanation about why vaping products are not any safer than regular tobacco cigarettes. I understand that there are even new nicotine-related products being developed.
There is one new product that is now on the market. It's called IQOS. IQOS. It was actually introduced in America in 2019, and it stands for I Quit Ordinary Smoking. It looks like a regular cigarette using real tobacco. It's actually an electronic device that heats the tobacco rather than burns it, and it results in an aerosol. And that's how they advertise it, of heat rather than burn. However, it is non-combustible. And while it does not include the flavored liquids, it does have an increased level of nicotine. The only research on it is from the companies that produce it. It should be noted that heated tobacco products have not been proven to be safer than cigarettes.
So what is your message for pediatric nurses?
Number 1 is recognize that this is an epidemic, and we must take action to protect our children. Number 2 is we can act by changing policy, such as promoting state restrictions, such as raising the smoking age to 21, or banning online sales, banning flavorings, and banning advertising to children. Michigan has actually become the first state, or will be by the end of 2019, to ban any flavored vape products. And Beverly Hills, California has banned the sale of nearly all tobacco products. Another action that can be taken is to become educated on the facts and get the word out about the dangers of all the vaping products. Be aware that there is something called the American Vaping Association that is blaming all of the negative consequences on the THC, or the marijuana, and the other synthetic drugs, but not on the nicotine. But keep in mind that the nicotine has to be in some solution in order to be vaped. Another action is that when a child says that they're not addicted because you have challenged them, ask them if they can forego vaping for a week and see if they have any symptoms, or if there's a change in their mood or their ability to concentrate. Ask the following questions to your adolescent patients. When was the last time you vaped? Don't ask them, have you vaped? Ask, when was the last time? Ask, have you ever tried to stop but couldn't? Ask if they have strong cravings to smoke and felt like they needed a hit or a puff. Another intervention is for those of you who work in hospitals or clinics And when you're admitting a patient, we have to change the words we use when asking about smoking. The question should not be, do you smoke? Because they don't perceive themselves as smoking. You may need to change it to either smoking or vaping. Don't ask the number of cigarettes they use because that has no meaning anymore. Don't even use the word cigarettes. Ask how long it takes them to get through a pod. One of those pods has approximately the amount of nicotine in a full pack of cigarettes. So when you finish a pod, you have, in essence, smoked 20 cigarettes. Change the signs that are in your building from no smoking to no smoking or vaping. Be aware of the seriousness of this lung failure that can result from vaping. The onset is very short. They complain of shortness of breath and or chest pain that increases over just a few days and often results then in hospitalization. They may also complain of vomiting and fatigue. And we know that these mimic many other diseases, but we have to start taking this seriously if vaping has been involved. Certainly promote nicotine-free schools as opposed to smoking-free schools or cigarette-free schools. Make policies that ban both tobacco cigarettes and all electronic devices that deliver nicotine. It has been noted by the Centers for Disease Control to reject any youth tobacco prevention programs that are sponsored by the tobacco industries, as those have not been found to be effective in preventing youth tobacco use. And then warn youth about the risk of all forms of tobacco and nicotine products. Lastly, we need to teach parents and teachers the facts about vaping, including what the devices look like, how they can hide or camouflage them, and how youth are using them.
Dr. Selekman, thank you very much for sharing your expertise with us today. We appreciate learning more about how we can help confront this growing risks and crisis associated with teen vaping.
The Pediatric Nursing Journal podcast series is owned and produced by Genetti Publications, Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Janice Selekman is Professor Emeritus from the University of Delaware in Wilmington, Delaware. She is a leader and national expert on multiple topics related to children and adolescents, most notably the care of children in the school setting, children with chronic conditions, high-risk behaviors, and mental health. She is the author of School Nursing, a comprehensive text, certification reviews for both pediatric and school nursing, and over 100 publications. She is a past member of the Pediatric Nursing Journal Editorial Board and a well-respected national speaker. Dr. Bernice Mowery is a nursing research scientist from the Inova Health System in Northern Virginia and a member of the Pediatric Nursing Journal Editorial Board. For archived episodes of this podcast and to learn more about pediatric nursing, visit the journal's website at pediatricnursing.net. Full text of Dr. Selekman's article, Vaping, It's All a Smokescreen, is also available through the journal's website. You can subscribe to the Pediatric Nursing Journal podcast series on iTunes, Google Play Music, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services. And as a listener, you can save 50% off your first-year subscription to Pediatric Nursing. Simply visit pediatricnursing.net/offer to take advantage of this special discount.